Hello and welcome to this video. Today in this video we're going to discuss a little bit about some data of long COVID, what we know, what we don't know, and some data basically how it's impacting our daily lives. So basically what long COVID is, some people get infected and they recover relatively quickly. Some people get infected and they don't recover quickly, and 3 weeks post-infection, or 3 weeks after they initially test positive, they're still feeling sick. So this is some data from the CDC website. What you need to know: post-COVID conditions can include a wide range of ongoing health problems. These conditions can last weeks, months, or longer. Some people got sick in 2020 and unfortunately they are still sick. Some people will have just minor long COVID symptoms. Some people have moderate, some it gets relatively severe. I mean, there are a wide range of symptoms. There's up to over 150, maybe even 200 different types of symptoms you could potentially experience. Let's talk about some of these symptoms here. General symptoms: tiredness or fatigue, which can mess with your daily life. Symptoms that get worse after physical or mental effort. Respiratory and heart symptoms. This is something that we see quite often. People talking about on social media. Difficulty breathing or shortness of breath. Cough. Chest pains. Fast beating or pounding heart, also known as heart palpitations. And I do have some sort of a form of long COVID. Every once in a while I get chest pain. My most common symptom is cough, and sometimes the coughing gets bad enough that it causes me to have difficulty breathing or shortness of breath. And I do use an inhaler for that. Another symptom that I sometimes have is I do suffer fatigue, and that can be a problem. And as we talked about above, tiredness. Some people do have that problem. Now here we go, neurological problems, such as difficulty thinking or concentrating, sometimes referred to as brain fog. Headache. I do sometimes get headache problems. Sleep problems. Yeah, I've had that a couple times. Dizziness when you stand up. Lightheadedness. Pins and needles feelings. Change in smell or taste. Depression or anxiety. Digestive problems. Diarrhea or stomach pains. And I said above, chest pains. Sometimes I get stomach pains. Haven't had it as much in a very long time, but it's a problem people have. Joint or muscle pains. Rash. Changes in menstrual cycles. And these are just the basic things of this. I mean, it could go on deeper, like neurological problems. We know people who have neurological problems, or like are older. Unfortunately, long COVID can cause dementia and Alzheimer's, and it does happen relatively frequently with older people, sadly. And those who are already on the beginning stages of dementia and Alzheimer's pre-COVID, well, after an infection, it just deteriorates rapidly. It dramatically affects what they see happen. What else does long COVID cause? Well, these were just the basic symptoms, but some of these symptoms combined together can cause effect. It can affect people's daily activity, and it does cause problems with the workforce. So before we get into that, how many people are estimated to have long COVID after infection? Well, it's anywhere between 10 to 30% of patients might experience long COVID after recovering, even if they weren't sick in the first place. So if you have a mild infection and you're thinking, oh, it's just mild, I'm fine, it's not going to be that bad, blah, blah, blah. Guess what? Don't assume a mild COVID infection is a no big deal, because it's not. You could have a mild infection and then several weeks later start having post-COVID conditions such as what we just talked about. And a lot of people, most people who have long COVID, generally do have a mild infection. It does not take a severe COVID infection to cause long COVID problems. However, if you should have a severe infection and you should end up in the hospital, don't think you can't get long COVID. You can too. It does happen. But it's just for whatever reason, there is a high number of people with mild infections that are getting long COVID-like symptoms. And believe it or not, a small percentage of people who have had asymptomatic cases, they can get long COVID as well. All right, continuing on here. Here's some more data from the CDC. So these are some questions that were asked. This is from data from back in September. Ever experienced long COVID as a percentage of adults who ever had COVID? So now in this case, we're looking at all different states. And anything in light green is 21.5 to 26%. Slightly brighter is 26 to 29.9%, and the darkest shade of green is 33.6% to 49.4%. And what you'll see here, states ranking, the highest ranked, believe it or not, is West Virginia. Look at West Virginia. Time period from September 14th to September 26th. Percent of people who had COVID who are experiencing long COVID symptoms. 49.4% of people in West Virginia. The state with the least, or well, close to the least, is coming up as Pennsylvania. And Pennsylvania confidence interval is 26.5% to 38.3%. So in Pennsylvania, generally what it's trying to show here is these are a percentage of people who have ever had long COVID. It's over 30% in Pennsylvania. Here's another one that's interesting. We'll just take a look at New York here. New York, 29% of people who had COVID are experiencing long COVID symptoms. California, it's lower, 26.3%. And maybe one of the reasons why it's lower, California is one of the states with the highest number of coronavirus cases. Let's just do a couple more here. Texas. Texas has had a lot of cases. 29.9% of people who had COVID in Texas are experiencing long COVID symptoms. And then we come up here to Washington State, 30.4%. Let's take a look at Vermont. Vermont at one time was the state doing the best. And here you go. So Vermont's actually lower than I thought it was. Vermont, 21.5% of the cases are long COVID. That's not bad. That's actually better in California. And here I had thought California was one of the better states, but it's coming up here as 21.5%. All right, there's more questions here on the list. Any activity limitations from long COVID? So let's see here. In some states, and we don't have all states on here, but some states are having significant, where the people have had coronavirus long COVID, how many of them are having long COVID activity limitations? Texas. 87.6% of people in Texas who have had long COVID are experiencing activity that's limiting what they can do. It's like their daily functions, they can't do it to their fullest expectations because they have long COVID. 87.6% in Texas. California. California is currently at, let's see, there we go, 79%. Michigan, that's relatively high, 83.9%. Nebraska, 77.9%. How about Florida? Florida, 80%. So this is a big deal here. It's a high number of people with long COVID. It's restricting at least somewhat of their daily limitations. But we can take this a step further. There was another question. Significant activity limitations. And it's generally the same states here listed. Look at this. Texas, 41.5% are having significant limitations of those who have long COVID in Texas. Florida, 17%. How about Alaska? 20.1%. How about Washington? 26.9%. How about California? 19%. So you're seeing where we're coming here, where I'm coming from. And if they're having significant limitations, you can bet that's affecting the workforce. And we can type this in. Long COVID job shortages. Let's just see what happens here if we type that in. And it says here, on this one, The Guardian's saying at least 7% of the job shortages out there right now are because of long COVID. I've seen where it's anywhere as high as 10 to 15%. So you're seeing where I'm coming from. Long COVID is a big deal. We don't understand why some get it, some don't get it. Could it be because some people are having higher viral loads and because they're just simply more sick? Or have more of the virus in them. It's causing them to take longer to recover. Is it because it's attacking the brain? We generally don't know, and any doctor will probably tell you there's a lot that we don't know. And some people are having perfectly fine labs, like they're getting a blood test, they're not finding anything wrong with them. I had that happen to me when I first was diagnosed with. Well, actually, in the beginning, I wasn't diagnosed with long COVID. They dismissed it because they were finding nothing wrong, but I clearly was not feeling myself. I felt much different than I did before coronavirus. And since switching doctors, they're finding out, oh, you have 19% benefit from an inhaler with my breathing. My breathing's 19% better when I use an inhaler. That never used to be the case. My breathing was perfectly fine before coronavirus. So, everyone's having different symptoms. Some are having headaches, some are having coughing problems, some are having breathing problems, heart conditions, blood clots. That's a big problem that is going on, and that can lead to sudden heart attacks. And unfortunately, we're seeing these sudden deaths popping up. If you go to Twitter, account at MeetJess, a friend of mine on Twitter, she has done several, I think at least 6 or 7 threads now on sudden deaths. Take a look into it, and I'll link it down below. I'll link her Twitter account down below. She has done several on sudden deaths. You can't tell me that's not normal. It isn't. These sudden deaths, some of them, there's a huge increase in them, and some of them are definitely linked to long COVID, post-COVID symptoms, and coronavirus. Okay, so you see where we're coming from here. We're going to do more videos like this. I just wanted to do a general overview of what's going on with long COVID and why there may be shortages linked to it, what some of the symptoms are, and the percentage of people that are having difficulty performing their day-to-day daily activities. Alrighty, thanks for watching this video, and if you want to see more stuff like this, or anything else we do on the channel, hit the like and subscribe button down below, and thanks for watching.